Hi, my name is Tingwen, and today I'm going to be talking about rheumatoid arthritis. Rheumatoid arthritis is also known as reactive arthritis. It is an autoimmune and inflammatory illness. In this illness, the immune system destroys the healthy cells of the body, and when the cells is destroyed, it can cause swelling and pain. Rheumatoid arthritis affects the joints in the muscle of the body, and it can damage more than one joint at the same time. And as of right now, there is no cure for this for rheumatoid arthritis, and inflammation, swelling, and discomfort may be felt in and around the joints, as well as in other parts of the body. And rheumatoid arthritis usually affects the hands and the feet first, but it can occur in any joint. It usually involves the same joints of both sides of the body. Dr. Augustine Jacob, a physician at Paris Renown Hospital, described rheumatoid arthritis in the year 1800. Sir Alfred Garrett termed the disease rheumatoid arthritis and distinguished it from osteoarthritis in 1852. Previously, arthritis deformans was used to describe both condition. And Dr. Augustine Jacob, a physician at an asylum in France, described the sign of rheumatoid arthritis. An autoimmune illness, rheumatoid arthritis, is one of the effects that affects the immune system. It may also affect the whole body since it is a systemic condition. A person gets it when their immune system is misidentified healthy tissue in their body as an invading enemy. Inflammation arises as a result of the immune system response in the affected organs or tissue. It's possible that these organs might be affected by rheumatoid arthritis. Causes. Overuse of a joint results in joint wear and tear. Injury caused by aging, obesity, disorder in the autoimmune system, gene or family history, muscle sluggishness. A diagnosis of rheumatoid arthritis often does not come until the person is in their 60s, according to the CDC. There is a tendency for symptoms to begin slowly and steadily worsen over time. Flares are times of deterioration in rheumatoid arthritis patients' symptoms. It is possible that rheumatoid arthritis symptoms may worsen or due to stress, overactive, or the discontinuation of treatment. Obesity. Obesity is a controversial risk factor for rheumatoid arthritis when the adipose tissue are in excess. In your body, they can produce a lot of cytokines. Cytokinesis can cause inflammation. These are the same protein that rheumatoid arthritis joint tissue produces. Cytokines exacerbate existing joint inflammation in addition to creating other health issue. Obesity is linked to rheumatoid arthritis in a major way, according to the studies. This discovery emphasizes the importance of fat in inflammation and autoimmune diseases. Remission often follow flares, especially if the symptoms subsided or become minor. For the majority of persons, flare-ups and remission remain a permanent feature of their illness. The same joints on both sides of the body are generally affected by RA. After a night's sleep or a period of inactivity, pain and stiffness tend to get worsened. Age fact. Rheumatoid arthritis is a chronic inflammatory illness that worsens with age. It is seen in all ethnic groups and at all age, with frequency rising with age and reaching roughly 2% in elderly population. Researchers have looked at a variety of genetic and environment variables to see whether they affect a person's chance of acquiring RA. The onset of RA may occur at any age, although the chance rises with age, and adults in their 60s are most likely to get RA. And RA may cause joint deterioration that may result in disability if left untreated. It can also create additional tissue throughout the body. Treatment may assist in managing the intensity of the symptoms and may lessen the probability of having problems as a result of the condition. With increasing of age, arthritis in joints become more and more severe. Okay, injury. When a joint is injured, it may not heal correctly, causing cartilage degradation. This may cause discomfort, stiffness, and even progressive degradation and when bones scrape against one another. And any significant joint trauma may cause an indefinite localized chronic inflammatory condition, which may lead to the spread of IM to additional joint. The onset of RA after trauma is a real phenomenon. And RA may cause, post-traumatic osteoarthritis is a kind of arthritis that develops as a result of an injury. It may be brought on by sports injury or even common stumbles. When a joint is injured, it is possible that it may not heal correctly, resulting in the degeneration of cartilage around in the joint over time. Symptoms of RA such as pain, redness, stiffness, swelling, tenderness, and warmth. And does everyone experience the same? The symptoms of rheumatoid arthritis are unique to each individual who suffers from this chronic condition. Some patients go for lengthy periods of time with little or no symptomatology, and others have it for many months at a period during a flare, which is an increase in disease activity. And the majority of individuals suffer long-term consequences from instances of more severe sickness. Because it is an autoimmune disease, rheumatoid arthritis develops when the immune system mistakenly target the healthy tissue in the body as a target for assault. And the cause of this, however, remains unknown. The antibodies produced by our immune system often target bacteria, viruses, and aid in battle against illness. Do the symptoms become more or less severe with age? Yes. The majority of persons with RA develop symptoms between the ages of 30 and 60. However, males are less likely than women to be diagnosed before the age of 45. Among both men and women, the median age at which the disease first manifests itself is 58. Okay, an occupational therapist can teach new and more efficient methods of doing everyday activities. This may help relieve joint discomfort. Painful fingers may learn to utilize a special design grasping and grabbing tool. A physical therapist may help clients build an activity regimen and advise them on utilizing assistive equipment like a cane. What is the physiology of rheumatoid arthritis? Anti-citrulinated peptide antibodies, known as rheumatoid factor, and inflammation are some of the things that show up when you have rheumatoid factor. And people who have rheumatoid factors are more likely to have rheumatoid arthritis. This has been known for a long time. An autoimmune disease called rheumatoid arthritis is caused by your immune system mistakenly attacking the tissue of your own body, which leads to inflammation. Treatments. Methotrexate is generally administered. Initially, it used DMARD and steroids to reduce the pain in joints. And then there are biological therapies, DMARD and also methotrexate, leflunomide, hydroxychloroquine, and ciprofloxacin. And the pros of this of the treatment is preventing the disease activity in joint and bone deterioration by starting therapy early is essential. Cons: due to the treatment of arthritis, the person can suffer from infection, headaches, nausea, redness around the injection site, and an allergy. During the medication of arthritis infusion, nausea and vomiting, low blood pressure, skin reaction, and breathing difficulties. Vision difficulties are among the less prevalent adverse effects. Additionally, calcium-rich diets may be necessary for those with rheumatoid arthritis, as several rheumatoid arthritis drugs may raise the risk of osteoporosis. Low-fat diet and dark leafy green veggies are excellent sources. Iron-rich food should be included in a person's diet during a rheumatoid arthritis flare-up, since anemia, which may lead to weariness, and can arise. Future of treating rheumatoid arthritis. For decades, doctors have relied on conventional disease modifying anti-rheumatic medications such as methotrexate to treat patients with RA. This medication functions by reducing the overall activity of the hyperactive immune system by biologics, which are a more recent treatment option, or a form of DMARD that is targeted. And the Janus kinase JAK inhibitor, which are available under different brand names, and it's the most recent medication authorized by the FDA for treatment of rheumatoid arthritis. And researchers are also searching for strategies to prevent rheumatoid arthritis, but none exists yet, and they can only postpone the development of rheumatoid arthritis. Lifestyle changes that may help, avoiding proper hygiene to avoid gum disease, consuming antioxidant-rich fruits and veggies. Okay. Informal interview. I conducted an interview with a woman for this purpose, and I asked her 5 questions. The first question is, how old were you when you got diagnosed with RA? She answered that she was 35 years old at the time. She has been afflicted with this ailment since she was a child. Her muscles are in discomfort, and she inherited the disease from her mother. She explained that her mother had the same issue, although she developed it later in life. My second question was, what medication are you currently taking? She has been suffering this condition for the last 15 years, and there is no long-term solution. However, she exclusively takes calcium supplements as prescribed by her doctor. My third question was, is the pain interfering with your daily living? She expresses how difficult it is to live with this condition. And with this condition, she's unable to do any hard labor, but her family supports her by assisting her with the housework and directing her to the doctor for a checkup. And my fourth question was, how do you balance staying active with the rheumatoid arthritis? She answered she has been taking calcium supplements and this has helped minimize her flares. She tends to do yoga with a bit of dog walking, but she did say that her ability to stay active changes in cycle. And my last question was, how are you managing right now? She expresses her gratefulness to her family for being supportive and help her handle the pain. She also joins a support group, and which is a great place for her to talk with people who knows what she's going through. Okay, this is the reference page.